So let's get started. After 2 years of the pandemic, we have had fear and uncertainty during what I would call our generation's most impactful public health crisis. Now, we are emerging with new knowledge and new awareness around the importance of health and wellness. Business operations need to continue, and we know that the success of our business is dependent upon a productive and resilient workforce. Let's introduce our speakers. So Leah Staff is the Director of Workplace Wellness. It's a national division of the LifeMark Health Group that implements wellness services for employers of all sizes in all sectors of Canada. She has been in the wellness industry for 30 years. Her professional accomplishments include national recognition from Benefits Canada for 5 wellness programs under her direction in the areas of communication, engagement, and wellness. She believes that when you do what is right for the employee, you are doing what is right for the employer. Leah relies on exercise as her medicine. She loves to run, bike, and weight train, and she has been known to dance with abandon in her own kitchen. So Katherine Vanyang. Katherine is the LifeMark Interim National Nurse Lead. She is a McGill graduate who has been working as a registered nurse for over 14 years. She started her career on a fast-paced surgical unit where she saw firsthand the effects of uncontrolled, modifiable risk factors on an individual's health. She has since transitioned her focus to preventative care and public health. And for the last 10 years, Katherine has worked with LifeMark to provide health education across Canada. And Katherine is an avid hiker and a gardener. Thanks for joining us today, Katherine and Leah.
Thank you.
Hello.
So, let's see here. Okay, so I'm going to start this with a question for Leah. Leah, we have clear evidence that our healthcare system was much less accessible during the pandemic. Leah, how is this impacting employers as they bring people back to the workplace?
Employers are really concerned about the current health status of employees, both those who have been at the workplace throughout the course of the pandemic, but also people who have been working from home and now either they're doing a hybrid or they are bringing people back to the workplace full time. And we know that over the course of the pandemic, the general health status of most Canadians has been in a decline. There's been a lack of physical activity, poor nutritional habits, consistencies with stress, increase in alcohol use as a coping mechanism, disruptions in sleep. The list just goes on. And some of that impact is very visible, right? We hear people kind of joking, not joking about their quarantine 15 pounds that they've put on or getting rid of their COVID-19 pounds that they've put on, and they can see that. But what goes with those externals that are very visible is an unknown impact on people's health. And that's what employers are trying to figure out, is that with the health behaviors that people have been implementing, what have been the health outcomes? Because we know that within our current Canadian healthcare system, there are some serious constraints with people being able to access care. In the initial slides that you had up, you shared that over half of Canadians have reported that they've either had delays in accessing healthcare or have been unable to access healthcare, and an additional 30% just haven't even tried. So whether they're symptomizing in some way or have delayed or just not even thought about getting their age-appropriate physical examinations, that's 80% of your workforce that should have had care over the last 2 years or need that care over the last 2 years and haven't been able to get that. So what does that all mean is largely unknown as far as what kind of supports need to be provided.
Leah, I think that's a really good point on us trying to reach all those people, that 80% of the population that just hasn't had a chance to get healthcare in the last 2 years. When we've done our clinics in the past, of course, we want to reach everybody. But there's certain groups of people that we really look forward to making the appointments, and knowing that they have access to it at work makes them much more likely to just take those 15 minutes out of their day to think about their health a little bit more that they otherwise wouldn't have. So now over the past 2 years, we're trying to reach younger employees. So those younger employees that don't have a healthcare provider, that maybe have a healthcare provider, but they're young, they're healthy, they don't have anything really going on in their lives right now. So there's no point of they don't want to disturb the healthcare system. They don't want to waste the time. They know their family doctor's busy. I feel fine. I don't need to see my family doctor. We want to reach them. New immigrants to Canada that in the past 2 years, the last thing on their mind has been trying to just get a regular checkup appointment for themselves. This might be their first medical appointment in Canada. So this is a great way to introduce them to Canadian healthcare and to give them more resources of what they can look for after seeing us. And then also all the employees that have healthcare providers, they have specialists, they have chronic illnesses, they know they're supposed to be seeing healthcare providers, but they have nobody, they don't have the time, they know there's a backlog, they make an appointment with their specialist and it's 3 months from now. They've had diabetes for 10 years. So if I don't see my doctor this month, it's not the end of the world. I've been dealing with this chronic illness for years, but that takes away their chance of actually having good preventative care and good follow-ups. So there's such a large group of people that we're really trying to target with these clinics. And it could really, really help them get back into caring about their health.
Yeah, and on top of that as well, there's from Stats Canada evidence that people who have not been able to access that care and have been looking for it or knowing that they need it, 68% of those people have noted a marked decline in their mental health just from the worry and the anxiety about being unable to access services and care. So there's also an argument to be made that just giving them that first initial step is going to have a positive impact to some degree on their mental health as well.
Thanks both. This term, health screening, you hear about it a lot. Can you guys describe what exactly is a biometric health screening and what's the experience for staff, right?
Yeah, so I can take that. It is true. The reason we're all here is to discuss biometric health screenings, but it'd be good if we kind of put a definition to what a biometric health screening is. So we come to the workplace and we do a 15 to 30 minute screening, and it seems very simple. What we're doing is checking the employee's blood pressure, their blood sugar, their triglyceride level, their total cholesterol. We'll do a height and a weight, get their waist circumference. So it only takes us about 5 minutes to get these very simple health indicators, but they're very simple health indicators that can change a person's life, that can start them on a health journey, that can just give them so much more information that they didn't have before. And as Leah was saying before, just being able to talk to somebody about these health issues, or if they have a medical question that they've maybe had for 2 years, and then you go and look it up on the internet and you get overwhelmed by so much information, it seems silly to contact a doctor about, just to be able to be sitting in front of a healthcare professional and say, I know blood pressure is important, but I have no idea what it means. And when I look it up on the internet, it doesn't make any sense to me. Can you just give me a 30-second explanation? And a nurse to say, no problem. Let me tell you why it's important. Let me tell you what it is. Let me tell you what it means if it's high. Let me tell you what it means if it's low. That takes a minute or two, and suddenly the person feels they have so much more knowledge. So it really, really can help an employee feel empowered. These 15 minutes that we have with them, these very simple tests that we're doing, people walk out of there feeling like they're so much more knowledgeable than they were when they walked in.
And that's a big piece too for the employers to be able to help individuals with their personal health care literacy, which is, how do you find care? Well, an employer can provide that care right on site, understanding what these different terms mean so that they are empowered to make informed decisions, and then also helping them to navigate the healthcare system. But where do they go to next? Another piece of what the nurses do is do those referral letters to their doctors where it's appropriate. That, this is where your blood sugar is sitting right now. You really need to go talk to your GP and get some direction because you're pre-diabetic, or whatever that happens to be for different chronic risks. There will be that referral letter provided that employees can then say, okay, I need to do something about this, and go see my general practitioner.
Yeah. And beyond that, we might have 10 employees that all have high blood pressure. That doesn't mean we just say, here's your doctor referral letter, go speak to your GP. We ask them, how did you sleep last night? Are you feeling very stressed right now? Did you just come from a really important meeting? How have you been eating? Have you been eating really high salt foods? There's all these extra questions. And at the end of each participant's screening, they may have all had the exact same blood pressure and elevated blood pressure, and they all leave with different advice, different people that they should go and talk to, different things that they might be able to do at home to improve their blood pressure. So it's never a one size fits all. Every participant, when we're with them for those 15 to 30 minutes, feels like they're getting very individualized care. And I think that's what's really important, that as the nurse, we're looking at each person and saying, what can I do to help you specifically? So the employee really gets a lot out of that.
Leah, what aspects of the service are really valuable for employees?
I'll share the report card that gets generated as a result of all of the data that's input by the nurse, so that we can see exactly what that looks like. So as Katherine was saying, it is very personalized for each individual, and this report card is actually generated in real time. So it's our point of care data collection system that's called My Health Check. It is specific and unique to LifeMark. When nurses input the information into the app, it gives this report card so that there is an opportunity there for some very relevant coaching, because employees can see exactly what their health status is. It's very visual. Everybody knows what a green check mark means. I'm doing great in this particular area. They also know what an orange caution sign means, that I need to pay some attention. And then, of course, there can be some stop signs as well, where you are at high risk for different chronic diseases, whether it's heart disease, hypertension, cardiovascular disease, metabolic syndrome, and so on. The other benefit of this particular app is that we have data modifiers, which means that the nurse can temporarily change one of their measurements to see how it would impact their overall health. For example, with blood pressure, this particular person has 140/60, which is probably not going to happen in the real world, because this is a fake report card, if you will. But if they take that blood pressure from 140, say, over 105, if we can get that down to 135/95, they would see that orange caution go down into a green check mark. Therefore, it's not this insurmountable task. It's very doable. And then there's a coaching opportunity with the nurse to say, how do we want to approach this? We can approach it with sleep, with nutrition, with physical activity, and then they can decide what those next steps are going to look like. This particular report card also shows the health risk assessment, which can be added to any of the biometric screening clinics, where people are prompted when they go back to revisit their report card, which is viewable to them online through their registration, LifeMark registration portal. So it's there for them forevermore when they want to access that information. When they go back to revisit it the following day, they're prompted to complete the health risk assessment about what their personal behaviors are around nutrition, physical activity, sleep, stress, drug and alcohol use. And remember, drug use isn't necessarily illicit drugs. It can even be if you're using over-the-counters or prescription drugs from your doctor. Are you using them according to directions? Are you using them correctly? And what can be really interesting for employees is seeing the juxtaposition of their qualitative data about what their behaviors are in a very subjective way, and combining that with the quantitative data, those hard measurements by number that are collected from the nurse, to give them a total look about where their current health status is. Again, always with the eye of where is it that you want to go next and what makes the most sense for you.
I'd like to just add to that, because that's a perfect example that I've had with a lot of participants that I've spoken with, is that there are some participants that are very interested in the numbers. What they want to see and improve is my triglycerides are 1.7. How do I get them to 1.6? And that can be extremely motivating for them, and that they like to come back every single year and redo that blood work. They like to bring their blood work from their family doctor so that we can make sense of it with them, because maybe the family doctor just says, yeah, everything's fine. But then when we dig a little deeper, we explain what the numbers mean, we're able to say it's fine right now, but we can see it slowly creeping up. So maybe these are some things you can do to keep things stable. So we always are trying to get those numbers into a good place. But then on the qualitative side of things, we have participants that kind of don't care about their numbers. What they care about is how they're feeling. What they care about is that they used to exercise, and for some reason over the last 6 months they've lost the habit. How do they get it back? What they care about is that they feel like generally they eat really healthy, but they're not seeing any results physically, or they're not losing any weight. So then maybe sometimes we have to bring them back to the results and say, you might not feel like you look different on the outside, but whatever you're doing is working on the inside. Or it might be that we have to discuss your habits, all those qualitative things that you might not see numbers change, but that you feel better mentally, that you feel better, that you have healthier coping mechanisms, that you're less stressed, that you're sleeping better. So we're always working with both of those things, the qualitative and the quantitative, to really figure out what works, once again, for each individual participant. So I think that's a great way of showing it in our qualitative and quantitative data in our report cards.
Yeah, you never know what's going to motivate somebody. It can be one thing for one person, completely different for the next person that you sit down and talk to. But we're definitely seeing as employers are reintegrating these kind of services, like even over the last 4 or 5 weeks, some of our clients who we did provide the biometric screening clinics back in 2019, they haven't been able to give this kind of service to their employees over the course of the pandemic. So they're revisiting it now for the first time in, almost 2.5 or in some cases 3 years. But what we're seeing is, comparing the pre-pandemic to the current numbers, is there is a marked increase in engagement from employees. People are wanting to understand what the toll has been for them over the last 2 years. There is an inherent motivation there. So, you're getting people who are coming in. Those people that the nurses are seeing already have that first level of interest in what's going on, what do I need to know, and on top of that, what do I need to do? Because people are also reporting in their evaluations a higher level of motivation to take that next step and figure out what they need to do and go down that road towards a positive change and impacting healthier lifestyle behaviors to enable to improve their health status. So it really is a prime time, and it almost circles right back to what we were talking about at the beginning with the current constraints within our healthcare, that employees are going, hey, if I can get some help at work, I'm going to leverage that.
And it is clear that they appreciate it, because I will say from personal experience, I did a clinic last week and I had 2 or 3 participants that said, oh, I'm so glad this is back. I remember you saw me 4 years ago. So it is something that stays in their mind. They do remember the interaction. They are excited to, yes, they did it 4 years ago. They haven't had a chance to do it since then. As soon as it came back up, they re-signed up because they knew it was something important and something that they were looking forward to doing again.
That's awesome, guys. It's nice to hear those stories, Katherine. You know, I've got access to some of the actual feedback items from previous evaluations we've done after some of these clinics. I'm going to share some here. Let me read this off. One employee said, "Thank you so much for providing this test today. I found it very valuable." Another one, "Very informative and listened to any concerns, willing to help make lives better." I'll probably share 2 more here. "I really appreciate that the biometric clinic is offered here at work!" Exclamation mark, smiley face. And then just the last one here. It's actually a nice one, I think. "I would just like to thank the nurse for being so understanding with my emotional state today. Thank you so much for your caring way." Wow, guys. So we've covered quite a bit of some of the benefits for employees. Leah, can you help us understand some of the benefits for employers?
Absolutely. Employers do want to hear those feedback pieces first, right? You know, we're all there is a very strong element of humanity at the base of all of these services, and I'll circle back to that in a second. But looking at what the aggregate report looks like so that employers can be able to offer wellness initiatives that are going to target the highest need within the organization. And there are those, whether it's within you know, your wellness committee or your HR department or whomever, that is going to comb through the aggregate report from beginning to end. But there's also a fair amount of people on the leadership team who are going to want to take a look at the report and glean that high level of understanding about where they're sitting as an organization and the current health status within that organization. And so we've built the aggregate report to be just as visible and user-friendly as the personal report card is, so that they can see, okay, same thing, we've got some good check marks there, and then where are those orange caution signs where we want to put some resources and help people to move that needle as an organization. You can also see here for this particular sample, the report is for 2019 to 2020. It was a 3-month campaign that we have sampled and put together, and you'll see that all of the data, you know, comprises these first few columns. And then if this organization were to revisit this biometric screening at a later date, usually an annual, then that information would be in the columns to the right, and then year 3 would be further over columns to the right. And therefore, you'll be able to see where you are trending as an organization as that data shifts over time. And that's what leadership wants to see, is how are we doing as an organization? What plan sponsors are going to want to see is what's the sustainability of our plan? Where are some bubbles coming down the road that are going to impact us negatively? And how do we preclude that from happening? Offering wellness initiatives that are going to be seen as useful for the employees so that they do engage within the wellness program. We know that sooner intervention means better outcomes. It means less time dealing with illness, and less illness means more productivity. I was listening to the CBC a couple of days ago, and they were stating that within Ontario, there's currently a 2-year backlog for needed surgical interventions. We need to get people started on that path. If there's something that's coming down the road, we need to help them preclude that and get the help that's needed as soon as possible. And I think there was a question about, absolutely put your questions in the chat and we'll take them as we come up. So I'm going to just take this one. Could you speak to safety measures and considerations for COVID We haven't had many employees return to the office yet, and I think they'll be hesitant to come for this even if they know it will be helpful. One of the things that we found in supporting employers with their return to work safety protocols, communication is a really big part of that. If you have a vaccination policy, what is that vaccination policy, and sharing that with employees? If you are either encouraging or mandating masks within your workplace, Katherine, you can speak more to what the current situation is across the provinces, but a big part of it is that communication and letting employees know what the safety is going to be. Another part you can do that's really quite easy is, instead of having, say, 20-minute appointments, lengthen that out to 30, so that there is a gap between when employees are coming in and they're not going to be crossing over or seeing other people as they come and go for their appointments.
Yeah, I can add a little bit to the on-site of our nurses. So our nurses across all provinces, currently they are still wearing masks when they are doing the health screenings. And then from the employee side, it is up to the company. So if a company is having a lot of employees come in and they'd prefer to keep masks, or would just prefer to keep masks because there is some close contact, or even if they want the nurse to also wear a visor or increased PPE, we will always work with the employers to make sure that everybody feels safe. So we'll always go to the level that the employers are looking for safety-wise. Disinfection is still a very important part of our nurse training. So they know we're still disinfecting chairs, we're still disinfecting equipment in between participants. We're still doing screening. So same thing, that communication with employers. We should not be having any employees come in to do their screening if they're having any symptoms, if they've just tested positive. So there always has to be that communication. And we make sure that's very clear when we are setting up these appointments with the employer and between LifeMark.
Thanks both. There was another question that was popped into the chat, and I think this is a really appropriate time to address it if possible. So the question is that they want to know if there are any suggestions for doing this with a hybrid or mostly remote workforce.
I'll start with the mostly remote workforce first. With a remote workforce, this is a biometric screening clinic. In other words, there are physical measurements that are taken. It is a finger prick to get a droplet of blood that is analyzed. It is blood pressure. Therefore, doing it remotely just is not an option. What is an option is having the ability for people to talk with a nurse one-on-one. We call it nurse health coaching, where they would be able to have more of a subjective review with the nurse around their health behaviors or what concerns they might have, and where the nurse might suggest that they go for some intervention or for some proper screening with whether it's with their GP and so on. As far as a hybrid, what some employers are doing is making it an event. If they're bringing people back to work for a few specific days, that this is going to be part of one of those days, using it as a draw, as a, hey, we're offering support because we know it's not been easy, and we want to be able to help people with what's coming next. And it's not just what's coming right now. Employers are also starting to think, okay, we know that something is coming down the road. So we're not in post-pandemic. We are in a transition phase of the pandemic, and taking this opportunity when we can interact more and leveraging it to its fullest to give people that support and help prepare them for whatever is going to happen in the fall. We hope it will not be like 2021. But if one thing the pandemic has told us to expect for sure is that we don't know what to expect.
Yeah, I kind of see that. It's one of those things. We know that people have been avoiding healthcare, some on purpose, because they were actually told, don't go to your doctor's office unless it's an emergency. Given that so many people are possibly going to be working remotely, I think giving them the option to go to work at one point, like an event, and concurrently get their health concerns addressed is pretty much a great opportunity to re-engage with a workforce that is actually working remotely and not, not physically present for things like team events, bonding over lunch, over meals, those kinds of things. So thanks for describing those ways to kind of get around this.
Yeah, because we also know that there's a large percentage of the workforce that is feeling very disconnected from their work, from their coworkers, and also from their employer proper. And having this kind of a hands-on event where people are coming in is going to help rebuild those bridges and make those connections and secure those connections again for whether it's a hybrid or whether we do, see some kind of a semi-shutdown or whatever might happen in the fall, and that's not a prediction by any stretch of the imagination. But going back to the constraints of healthcare as well, people have been able to access some care, but there's also a concern about people who've only been able to access virtual care. There's been a shuttering of healthcare clinics, that there's been many doctors who have only been seeing patients either virtually or by phone. This is an opportunity to have a hands-on with a medical professional and have that face-to-face physical medical clinical experience.
Yeah,
Thanks,
I can
Leah.
just add for a few of the participants that I have seen recently, that has been a big concern, is that I say, do you have a healthcare professional? Yes. When is the last time that you had an appointment? Oh, it was 3 months ago. Oh, that's great. Did you do any blood tests? No, it was virtual. So they're not getting, it's a 5 to 10 minute appointment. Everything okay? Good. Okay. I've done my appointment. It's done. But they're not getting any added information. They're not getting any quantitative data. They're not being able to ask questions. So as Leah said, the opportunity to actually have an in-person visit with a healthcare professional is really important right now, especially since we don't know what's going to happen in the future. If more doctors are retiring, if more doctors are busy with COVID again, this is kind of like a quiet time. So we have to take advantage of it while we can.
Yeah, and that's what being an organization, healthcare literate organization is all about, is helping your employees become healthcare literate. It's giving them the resources that they need so that they can take care of themselves, because we've got 3 big pieces here. One is returning people back to work, whatever that might look like, within the context of a constrained healthcare system, within the larger context of a transition within the pandemic. And that unique intersection of bringing people back, limited healthcare, and the pandemic is still ongoing. And this unique intersection means that sending those messages of self-care to employees just is not enough anymore. We have to give them an entry point.
Thanks, Leah. There's one more question here, which is a really interesting question. I thought we should address it right away. If an employer was to book in the fall and things changed with the pandemic, I mean, it's looking like it's going to be a great summer, but everyone's talking about the doom and gloom of the fall that's coming. So let's enjoy our summer. But forward looking, what would be the requirements to cancel or to continue with clinics?
Yeah, we can absolutely start booking now for the fall. We are booking for flu season as well. We do have a pretty big grace period if you need to cancel or reduce the size of your clinics, especially if it's an impact from requirements from the pandemic. So we have a 15-day cancellation policy that right up until 15 days before that clinic, you can cancel that need.
Yeah, and we have seen during the pandemic previously, when everybody went remote, we have seen people switch to virtual health coaching, which, as we said, yes, in person is the most important. But even if we can switch to virtual health coaching, it's at least a longer personalized care where a person can get a little bit more information and improve their health literacy, even if it is virtual. Or we can always just change the way the appointments are done a little bit so that even if everyone is work from home, to have a place where people can come in, do their 15-minute appointment, and then leave, and make sure there's disinfection happening in between then. So there are ways that we can adjust our biometric screenings to make sure everything is done safely and that the employees still get their healthcare as needed.
That's great, guys. Katherine, Leah, thanks for joining us as speakers today. I am mindful of the time for our attendees. Very nice of all of our attendees to join us. What I'd like to do for these last few moments is I want to share a contact slide that will be available for anyone who has further questions about offering this service at your workplace. I think we have actually addressed all of the questions in the chat. They were very engaging questions. Thank you for all the interest. And again, you can reach us at the email and the phone number if you have more questions. And thanks again for joining us. It was such a pleasure to speak with everyone.
Thank you.
Thank you, everybody.